when is it time to not ignore the cough anymore or some of these symptoms and really get yourself either to your doctor's office or to the emergency room? When is it time to do that?
That's a great question, Laura. I think if you're over 65 years of age especially, you're at much higher risk. If you have a fever that does not abate, or symptoms that are progressively getting worse, or you experience progressive shortness of breath that is not improving despite your conservative treatment, or any chest pain, you need to go see a doctor.
Okay, so really just don't, maybe, and also in the best, probably the best advice, if you're not sure, call your doctor,
Call
right?
your doctor.
See a
Yes,
doctor.
absolutely.
Okay, well, call one of you. Okay,
Yes.
that makes sense. Now, speaking of that, when you do maybe see a patient and they are complaining of some of these symptoms, how do you go about diagnosing whether or not he or she actually has pneumonia? I know there are different ways to do a diagnosis. We have some of those here, so if one of you would like to talk about that.
Well, when they come to the hospital, we always do a physical exam, so that we also take the lungs, as we want to listen for different breath sounds like wheezing or rhonchi, that kind of thing. The chest x-ray will always show us pneumonia. Blood test can show us if the white count's elevated. That's usually indicative of an infection going on. And also the sputum culture, which we take a test to see what kind of bacterial infection is causing the pneumonia.